Hello, this is Dr. Eric Prather. I'm your Louisiana chiropractor coming to you from Lafayette, Louisiana at Prather Chiropractic Services. And today we have with us Miss Tootie Smith, who's been a patient of mine for probably 15 years or so, I would say. Is that pretty accurate?
20.
20 that long? 20
Yes.
years? Okay. And I wanted to do a video with Miss Tootie today because she's notoriously been one of my most difficult patients to adjust. Through no fault of her own. It's just certain body types are more difficult to adjust than others. But we've had some success despite using a lot of different techniques and procedures to try to get the adjustment. But since we've included the new spinal decompression procedure, and we're going to get her reaction to receiving that treatment the first time, I definitely wanted to capture that on video, because that's going to be something we've not done to you obviously before, and I'm just really eager to see how you tolerate it and what kind of result we're going to get from that procedure. Now, she presented to us today with what's your complaints today? Got a little bit of numbness in the hands.
Numbness in the hand and in my feet. I guess plantar fasciitis.
Yeah, plantar fasciitis.
Yeah.
A little bit of sciatica going down the leg? Okay.
Yes.
Now, she came in to get her adjustment before she does her yoga. Now, you're doing yoga once a day?
Twice, 3 times a week.
3 times a week, okay. So that's pretty good routine. And I think stretching is probably one of the best complements that you can do for chiropractic adjustments. Exercise and resistance training is certainly important, but stretching really helps support adjustments and encourages that proper joint motion, which is the whole name of the game by getting adjusted, is we want to improve joint motion. And yoga is a great complement to that. So if you're new to yoga, start easy, use beginner courses. But I think you've been doing yoga since our recommendations, what, about 5 years now?
I would say 9.
9 years? Before that, you were experimenting with the Pilates?
Yes.
Some
Pilates,
success, some not success. Right.
Yes.
Certain movements in the Pilates that really engage the core can stress the lower back. So if you have a weak L5, S1 complex, you have to kind of know what you're dealing with your spine before you do certain exercises. So check with your doctor, check with your chiropractor about specific maneuvers within a system of exercise to make sure those particular maneuvers are safe to do, because some can do more damage to the spine than actually help it. So every case is unique.
Yes.
All right, so we've got the sciatica today. We've got a little bit of numbness and tingling in the hands. You've been getting adjusted about once a month. Right. But today's a new procedure. So let's get into it. Ms. Tootie, you ready? All right. Let's go ahead and take your glasses off. All right. We're going to have you lay down right here on the biophysics table. There you go. Pull yourself up.
3 times.
Okay. There you go. Relax. Okay, we're going to start by checking her leg length here. She's a little short on the right. Let your knees bend, Ms. Tootie. There you go. And that stays short. Any tightness in the lower back?
No.
Any tightness in the front of the thighs? I feel some resistance there.
Yes.
Okay. All right. So Ms. Tootie complained of a little bit of numbness and tingling going down the leg, and having to prop her leg up to get some relief, which is kind of a classic sign of some sciatica. She it's instinctive to try to put the nerve in a shortened position, and a lot of patients will prop their leg up on a counter or in a chair like that to shorten the sciatic, which gives some relief. So you've been playing in the garden quite a bit?
Yes.
Right, so
you're right about that.
Right, so probably did something to aggravate an existing problem she has in there that we've been managing. So we're going to start by releasing the sacrum, working in the pelvis, going up through the lumbar, thoracic, full spine adjustment. Okay, you're going to feel the table kick up. Ms. Tootie, let's pull you down a little bit. Okay, I'm going to start with the sacrum. You ready?
Yes, sir.
Okay, good. Now, I have to use a tremendous amount of pressure on Miss Tootie, and she's so small in stature that's very, very atypical. But to get any release at all in her joints, you see it takes a lot of force. Okay, so it's great that we have this table here to assist us, and it helps reduce some of the pressure, and we overcome that by using speed of the table drop to help assist us with the movement. Go ahead and roll over on your back for me now, Miss Tootie. Okay. Good. I'm going to put the head in the center here. Okay, Miss Tootie, now we're going to be adjusting the cervical back over your shoulders. Okay, you're going to feel the headpiece kick up. Contact the cheekbone there. Okay, now take your arms, Miss Tootie, and open them wide, just like that. Just drop them down. I'm going to work the shoulders, the clavicles, rib cage. Okay, let's hands on the tummy for me. I'm going to decompress the leg here. Okay, good. Oh, good release there.
Yeah.
I felt that in the knee and everything else. Okay, let's go ahead and sit up. Let's go ahead and sit up for me. And spin to the right. All right, let's work those shoulders. Felt a little bit of crepitus, that thorn dangle in that right shoulder. Crepitus is the grinding we'll feel inside a joint when it's not tracking properly, or there's a little bit of cartilage damage in there. Good release there. Crepitus is the root word of decrepit, right? So when we discover crepitus in a joint, that means you're decrepit. How do you like that? Is that good info?
I don't know. What's that mean?
Decrepit? Oh, decrepit kind of means old and crippled up. And
I'm old.
You're not old. I'm just teasing you. Okay. Okay, good release there. It's fine. Smooth out these joints. Release the pressure in the joints so we can smooth out the movement. That's the key. All right, so far so good?
Yes, sir.
Okay, now we're going to switch over to the decompression table for the decompression procedure. Yes, ma'am. Okay. Now this is new for you, right, Miss Tootie?
Yes, sir.
Never had this. I'm going to lower the table so you can hop up there. Now this is a manual decompression adjustment. We're going to be decompressing your spine along the y-axis, trying to make you taller.
Okay.
Does that sound like?
It sounds good.
Yeah, that sounds good. Okay, have you sit right here for me.
Sit.
Sit, yes ma'am. Okay, and then have you lay this way, lay flat on your back. We're gonna kick your feet up over here. Now, you've never seen this done? You have no idea, huh?
No.
How this works or what it is? Never saw videos of the procedure or nothing? Okay, I'm gonna line your hips up with the table here. You felt this. We'll pull you down. Okay, now we're gonna put your spine in a neutral position, Ms. Tootie. You wanna let these legs elevate. Just keep them relaxed. You're gonna feel the table lift the legs up, okay?
I like this.
Yeah, that's pretty fancy, huh? I like so. Now, to keep your body from sliding, we're gonna pin you to the table. It's gonna be a tight squeeze. Just like that. Don't want you to slide. So here we go. Big tight squeeze here, Miss Tootie. Probably tighter than you expect.
As small as my waist.
Okay, I'm gonna actually have to go one notch tighter.
Oh.
There we go. Let that settle in. Let that settle in. Okay, we want to be in the fleshy part of the side, above the pelvis. You okay there? All right. All right, student, we're gonna decompress the spine, all right? Want you to keep your teeth touching. Don't bite your tongue. Continue to breathe through the nose. And just wiggle your big toe. Okay, breathe, 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 breathe.
Oh.
Keep breathing. Never had anything like that, huh? Keep breathing. Let it settle in, okay? Let it settle in. Now, how far down did you feel that? Yeah, all the way to the belt, huh? Catch your breath? Yeah, yeah. That's good. That was a good release. That adjustment's never been done before. And what happens on these first 1 or 2 adjustments like this is there's a lot of spinal adhesions that get broken up, okay, along the y-axis, referred to that as the y-axis. So I think you tolerated it pretty good. It was about as intense as I expected it to be for you because it had never been done before, but you took it like a champ. Good. And I think when you stand up, you're going to start to let that head go here. You're going to be able to share with us a little bit about what you felt, and I'm kind of curious to get your take. She's in lost for words. That's what you call that. All right, sit up. Sit up for me. All right, can you tell me a little bit about what that felt like? Or tell the camera what that felt like?
Well, I know my neck's kind of like
You feel increased range of motion.
increase here.
So you felt that release all the way to the belt line.
Yes.
Right, and that's a release you've never felt before.
Mm-mm.
No, we've never felt anything like that. Okay.
No.
All right, go ahead and walk that around for me.
It feels good.
Yeah, you feel taller?
Yeah, I feel like I'm taller, but I don't think I am, but I feel like I'm taller.
Okay. Well, as we do this adjustment, include this in your routine, they do get easier, all right? The first one is usually pretty intense because of, you know, like we talked about, the long-standing scar tissue and whatnot. But as we break all that up and improve the movement of your spine overall, you're gonna see increased joint mobility, pain reduction, you know, you're just gonna feel better in general. It's a type of an adjustment that really no other chiropractic system addresses. And so we're able to release the spine in a vector that can't be done any other kind of way. So, good to go?
Yes, sir.
All right. Well, thanks for letting us record that adjustment.
I think I'm feeling good now.
All right, this is your Louisiana chiropractor, Dr. Eric Prather. We'll see you soon.